Myself, I'm Brennan Ninesling, and I'm a third year medical student, part of the International Med Scholarly Concentration. And then with me today, I have Dr. Lynette Menezes. Dr. Menezes, I don't know if you'd like to introduce yourself at all, but I do have some questions for you as well.
I oversee all of the global programs for USF Health, which includes the colleges of medicine, nursing, pharmacy, and public health. And I'm really pleased to talk with you this morning, Brennan.
So I guess for starters, if you could just tell me a little bit about how you got into the field of global health.
So this is a really long story, but let me tell you, it goes as far back as when I was 14 years old in ninth grade, and I visited a local leprosy hospital. And I was, at that time, a part of a program called Young Students Movement, which allowed us to visit some of these local charities around. And it really moved me when I went into that leprosy hospital, because there was a lot of social stigma and discrimination at that time for leprosy, because most people thought it wasn't curable. And so we, as a student, and then I got a group of friends together where we started volunteering with the hospital regularly and creating awareness programs, teaching schools and churches about leprosy, creating, having marches. And at that time, there was no social media. So of course, we didn't have the option of using WhatsApp and Facebook and many of these other ways of letting people know what is going on in the world. So we were reduced to going around and talking to people and having posters created and flyers distributed. And so that's how I really got involved in working with underserved populations. And that led me to finally go and work in a rural hospital, which was also a leprosy hospital. And I opened a lab at that time because I had a bachelor's in microbiology and was trained in working in laboratories. And so I opened a basic laboratory at that time for 2 years in a rural setting. From there, I came to the US to study further. And when I was doing my PhD, I went back to India to again work in a rural setting, collecting data on domestic violence. So I think it was all of these experiences that really got me hooked into global health. And that's how I have continued working in the field.
That's awesome. And then I guess through that story, you've brought up, some of the answers to the next question, but it just generally what makes global health so important.
So if you look at the world today, we are very, very interconnected. Right from the clothes we wear to the shoes we buy to the technology we use, a lot of it, and the food we eat, a lot of it is manufactured and produced in other countries. And often those countries are really in the developing world. And so there is really no us and them anymore. It's we, because we can't live in isolation anymore. We are a very privileged nation. So it is incumbent on us to help people all over the world, and particularly in countries where there are such meager resources. But the one problem that globalization has also done has increased the disparity between the rich and poor. And it is so apparent now with the current pandemic that we see, where people in developing countries are affected in many more ways because of the kind of measures we have in place today. So it has really undermined the social fabric of our society, this pandemic, as we say. And I think I rest my case when I say that how much more important can global health be when we have this pandemic that has affected more than 200 countries and regions in the world.
And you brought up the idea of globalization of a global community. So how does USF Health contribute to the global community?
So I think one of the things that USF Health has done really well is we have tried to harness the diverse expertise of all of our different colleges. So we have faculty from the colleges of medicine, public health, nursing, and pharmacy, all working together to effectively address all of these global pressing problems that we have, particularly in the field of infectious diseases. And through our academic programs, we have been training students, particularly in the College of Public Health, because the others are professional schools. We have been training students from many other countries who have taken on roles in their countries to improve public health systems. They are either deans of public health schools, or they are working in nonprofit organizations or leading ministries of health. So we have tried to impact that through our academic programs. We've also sent, I think, over 1,600 students abroad in the last 5 years. And these students are engaged in field work, they are engaged in clinical rotations, they do a lot, they conduct research. You've been one of them. You've traveled to Panama to do research in Zika. We've had students working in doing research in Uganda on, working with one of our faculty members, looking at women with obstetric fistulas. So there's a wide range of research that our students have been engaged in. And we also have a very strong faculty presence, particularly in the area of parasitology. So we have faculty that are doing research in malaria. Dr. Li Wang Chui has a whole Southeast Asia center for malaria research, where he is working on looking at drug resistance issues in Plasmodium vivax and falciparum because of this whole threat of emerging resistance in the greater Mekong subregion. We also have Dr. Yu Nash, who's been working on eliminating onchocerciasis in Uganda. And Dr. Adams has been working with malaria and looking at therapeutic interventions and drug targets, and working in Thailand and some of those areas as well. So we have a strong global research group. And they've also been training postdocs and other students from different countries in their labs. And then when we talk about capacity building, the College of Medicine has been very engaged in training hospital administrators from a rural province in China, and also subspecialty trainees. So these administrators come, for about 2 weeks. They rotate with all of our leadership at Tampa General Hospital and some of the other hospitals in Tampa, and they learn how to really improve their hospital system. I think in this current pandemic, that helped them a lot as they were trying to navigate all of the issues that they faced in running these hospital systems with such an infectious threat. We've also been training a lot of subspecialty trainees from these hospitals. They stay with us for about three to 4 months and rotate with many of our faculty in medicine, and truly learn how to improve their different specialties when they go back. And I think one of the things they always point out is the patient-doctor relationship that people always forget about in many of the developing countries, because that's not as important as we have it over here, where our doctors really work with our patients closely. And there are many challenges in those countries as well, because if you see, they see a far larger number of patients than we do. But within that system, they have tried to put in different interventions so they can improve their systems as well. The other areas that we have been working with is we've hosted a lot of, have a very robust student exchange program. So I think we've probably hosted nearly 400 students from about 20 universities now. And we've trained over 150 subspecialty trainees. We have a strong international medical graduate program where graduate trainees from different parts of the world come and train with our physicians for a month. And some of them stay back and complete their, do residency here, and many of them go back. So there's a diverse range of experiences that we have at USF, and we've been contributing in many ways to global health.
Awesome, thank you.